It began early this morning. Almost 100 workers represented by Unite the Union are picketing outside St. Bernard's Hospital today. They're arguing for better pay conditions, for better working conditions. They say that during the pandemic, they were asked to step up and they were differentiated from others holding similar grades across government departments. They say that now the pandemic is over, they are no longer differentiated and are on the same working and pay conditions as others across government departments.
During the pandemic, we were forced to come to work because we were needed as essential workers that we are. So we were here, and the management at the GHA asked for help to the Department of Education, which they refused to send any other domestic outside from the GHA to help during the pandemic, as they were not a clinical setting and they were not the same as us.
What sort of things do you guys do at the hospital on a day-to-day basis?
On a day-to-day basis, we take out all the clinical waste, all the rubbish, the cleaning area. They provide the hygiene, the cleaning area, and it's on a day-to-day basis.
We do the linen department, where we deliver and collect the dirty and clean linen to all wards. Like he said, the clinical waste bins, changing of dirty curtains, you name it, we do it here.
We are only asking for like a 10% pay rise of our minimum wage. Like it's about nothing.
Are you guys on minimum wage, you say?
We are minimum wage.
We have to do one Saturday, one Sunday as a shift. We don't get a shift disturbance at all.
Cleaners in other departments are being treated differently, and they, of course, work in a clinical setting. So by virtue of the fact that their work is with infectious diseases and they are at higher risk, that should be recognized, and you can understand where they're coming from. You can also understand the very human element that, there's a staggering rise in the cost of living, and people are feeling it. People are very much feeling it.
Well, they've put forward a proposal, but unfortunately they've said that they're not willing to move or put forward any other proposals. They put forward an offer. We've gone back with a counter offer, hoping to negotiate, but they're unwilling to move.
At the end of the meetings, they've come up with a 4%, that it's around £911, around £14 of an allowance. We have refused because we think they could better that for us, working in a clinical setting as we do.
There's posts that have been covered for over half a decade, and I think it's time to give that post to the person that's covering it.
So there's long-term covering and acting.
Yes, and permanent. It's not like you're doing maybe a couple of weeks and then another person. It's the same person doing the role that should be already with the benefit of giving them the contract.
Members obviously don't want this to affect the users, because that's not their intention, obviously. So they have agreed to have a number of people to cover clinical areas that are critical to ensure that user safety is not put at risk.
I really do think, from what's being heard on the streets, from speaking to people, that this is unfortunately going to be the first of other departments to follow. It's extremely concerning.